Good morning and welcome to Ask the Expert. I'm Joe Taylor. This morning, another in the ongoing series of programs presented by the Northwest Regional Key Program for Quality Early Learning. The program, through the Northwest Institute of Research, oversees a grant from the Office of Child Development and Early Learning at the Pennsylvania Department of Human Services and the Department of Education. The goal of the program is to improve the outcomes for young children as they prepare for school. John Poza from the Pennsylvania Key is the host of the program and is with us throughout the series. And John, who's on the line with us this morning?
Good morning, Joe. This morning, I am very pleased to welcome our new Department of Human Services Secretary, Teresa Miller from Harrisburg. And we've got a lot to talk about with Secretary Miller. She was just recently confirmed into her cabinet position, and I wanted to welcome her to the show. Welcome.
Thanks so much, John. It's a pleasure being here.
Yes, so good to have you. So for our listeners and folks who may not be familiar with you and your background, can you tell us a little bit first off about prior to becoming and being appointed as the Human Services Secretary in the state, what your prior background was all about?
Absolutely. So I've been with the Department of Human Services now since August. Prior to that, I served as Pennsylvania's insurance commissioner. I did that since January of 2015. While I was in that position, I was really focused on expanding access to quality, affordable health insurance, enforcing mental health parity laws, and innovating in the long-term care private market space, and really just generally focused on protecting consumers. Prior to coming to Pennsylvania, I worked for the Obama administration implementing the private market reforms in the Affordable Care Act. So I was working to ensure consumers across the country were receiving the benefits of the Affordable Care Act and working on issues like the federal mental health parity laws and ensuring consumers across the country benefited from those laws as well. And before that, I served as the insurance commissioner in the state of Oregon. And before that, I advocated for a number of human services organizations in Oregon. So 20 years ago, I was working to pass mental health parity legislation at the state level, working with organizations like the ARC of Oregon, Disability Rights Oregon, where we were pushing to close state institutions and transition people into the community. Many of the same things that we're doing here in Pennsylvania today. So it's exciting for me to be working on some of these same issues again. Absolutely.
I can see the very close correlation between your work in the insurance industry and with Department of Human Services, obviously.
Yeah.
Yeah. Now let's talk about the current proposed budget in Pennsylvania for human services, specifically as it relates to early learning programming. What is proposed in terms of the department right now regarding how our funding is looking at, how we're looking at the funding currently?
Yeah, so in the governor's proposed budget for 1819, he is proposing a $25 million child care initiative. This would be $25 million of state funding matched with $5 million in federal funds to expand access to high-quality child care services and support low-income families in Pennsylvania who may be struggling to stay in the workforce because of the cost of child care. And this initiative really builds on the current fiscal year's $10 million investment in the child care wait list. So we know the wait list continues to grow, and this is the wait list for subsidized child care. We're projecting the wait list to reach about 2,500 children by the end of the fiscal year. So this 1819 initiative proposes $10 million to provide about 1,600 additional low-income children and families access to child care. So that's a portion of it. We're also proposing $10 million in state funds matched with $5 million in federal funds to increase tiered reimbursement rates for Star 2, 3, and 4 providers. We know that child care providers haven't seen a rate increase in over a decade, so the goal with this initiative is really to improve wages for child care workers. Part of this funding is also going to a one-year pilot program, so we're targeting $3 million to establish a one-year pilot program focused on early care and education programs for children under 3. We're proposing with this pilot to leverage our model for the Pennsylvania pre-K counts to pilot about 200 contracted slots in our subsidized child care program for the next fiscal year. So our goal with this program is really to improve access and continued enrollment in high-quality early care and education programs for children 0 to 3. And we'll do this by contracting about 200 slots in a select number of high-quality Keystone Star 3 and 4 pilot sites. You know, we know child care, particularly high-quality child care, is limited in availability for both subsidized as well as private pay families. We know some regions have reported wait lists of up to a year in Star 3 and 4 programs for infants and toddlers, and that's even when families are paying out of pocket. So by using contracted slots like we do in Pennsylvania pre-K counts, we're hoping to incentivize high-quality programs to serve our most vulnerable infants and toddlers.
There is a proposed program, I think it's $4.5 million, for home visits to benefit preschoolers in homes in communities described as at risk. What is the definition of at risk in terms of a community?
Well, so this initiative really builds on the governor's commitment to support individuals who are struggling with opioid use disorder and substance use disorder and their impacted families. So we're going to be targeting an expansion of existing evidence-based home visiting programs really aimed at those areas hardest hit by the opioid epidemic. So we've got a multi-agency effort going on now to try to fight this epidemic facing our communities across the Commonwealth. And so as part of that effort, we are going to be working with Department of Health and other agencies who are involved in the command center that we now have since the governor declared a disaster with this epidemic. And through that command center, we'll be targeting those areas that are hardest hit by the opioid epidemic, and that's where this $4.5 million will be focused. But you know, evidence-based home visiting programs have really a family-centered focus that works with both the parent and the child. And we know studies of various home visiting programs have shown positive impacts on children's cognitive development and behavior, higher grade point averages and achievement scores at age 9, and higher graduation rates from high school.
Now, I know, Secretary, you had a recent family center visit in Bloomsburg, and from what I understand, it was really an amazing experience where you met with families there and center staff personally, and you saw really firsthand how much that family center model has improved the lives of those children and the families that have been impacted.
That's exactly right. This was a pretty amazing event for me. I've enjoyed over the last couple of months going out and seeing some of these programs up close and personal, and this was a great visit. I had an opportunity to sit down with a couple of families, and I say families on purpose because these programs really are aimed at the entire family. And I got to talk to them. I got to see the kids and talk to the home visitors, the individuals that are going into these homes. And these families I talked to just talked about how amazing these home visitors are in their lives and the impact that they have. They talked about how, you know, they'll come to their homes with activities to do with the kids where the whole family, again, is engaged. And these are, you know, age-appropriate activities where, you know, mom and dad can see this individual interacting with their child, can see really what their child can do, can make sure that their child is developing appropriately, and certainly can raise a red flag if there are any issues. But they also just talked about how, you know, this is somebody that comes into your home that you can ask any question of. And, I know I'm a relatively new mom myself. My daughter just turned 2 this weekend.
Oh, congratulations.
And I personally I kept thinking to myself, I want a home visitor because I have no idea what I'm doing as a new mom, and I have a lot of questions. And so having somebody that knows a lot about kids who can come in and tell you, what's normal, what's not, what you should be concerned about, what you shouldn't, and how to interact with this new person in your life that changes every day is pretty incredible.
We had a guest on our last show. Her name was Brenda Gaffey, and she works with the Parents as Teachers program through a contracted agency called the Guidance Center in the Du Bois area. And we talked about Parents as Teachers, which is really a program that's provided in a home visiting approach. Mm-hmm. And one of the things that we discussed was that, sometimes parents, even though there's, we certainly want to reach the most at-risk kids or parents, a program like Parents as Teachers is really, it's a program that's available for anyone. And
mm-hmm.
and so often what happens is a parent, if they think about utilizing a Parents as program model, they think, well, I must be a bad parent if I have to reach out and use that service. But it's really not intended. It's really for all parents, is it not?
So some models are, and I think the model you're describing, the Parents as Teachers, and the program that I went to visit, they do serve anyone who wants to be served. There's no income eligibility
Right.
requirements, for example. With some programs, there are those eligibility requirements, but not with all of them. And I couldn't agree with you more. I think, this is one of those programs that I'm not kidding when I said I left there and said I really want to have a home visitor, because as a new parent, none of us know what we're doing. Unless other people have the secret and nobody's told me, but I really think, as a new parent, you have so much to learn, and having somebody come into your home and just talk to you about what's happening with your child, and somebody that you can watch interact with your child, I think that benefits absolutely every mom potentially. So I think that's a really good point.
You were talking about Parents as Teachers. We have a situation where we have grandparents as parents. We all too often see stories in the news these days. 2 parents found OD'd somewhere. They lose their kids. Thankfully, many times there are grandparents who step in and take the kids. But at their ages, that's no easy task. What is being done at the state level to help these grandparents who are forced back into a situation of being parents and with a child that may have been exposed to some pretty problematic situations at home?
Yeah, this is an issue that's becoming all too common, as you've just described, and one that we are really focused on right now. I think over the last several months, one of the things we've recognized is we have been, in this administration under Governor Wolf, we've been very, very focused on trying to address the opioid epidemic. I think a lot of our efforts, though, in the past have been really targeted at the individual struggling with addiction, which is obviously a place we need to be focused. But I think one of the things that has really become clear to all of us in the last several months is we also need to be focused on the family members, the children, the folks who are being significantly impacted by this epidemic as well. And so we recently, in fact, back in December, the governor and the 4 cabinet secretaries from the Health and Human Services agencies, we had a roundtable with grandparents